Marfan syndrome is a rare and complex genetic disorder that affects the connective tissues in the body. With its wide range of clinical manifestations, Marfan syndrome poses various challenges in terms of diagnosis, management, and treatment. As future ophthalmologists, it is crucial for us to have a deep understanding of the ophthalmic manifestations of Marfan syndrome and how they relate to the overall management of this condition. Marfan syndrome is primarily caused by mutations in the FBN1 gene, which encodes fibrillin-1. Fibrillin-1 plays a crucial role in the formation and maintenance of elastic fibers in various tissues throughout the body, including ocular structures. These mutations result in abnormal fibrillin-1 production, leading to structural abnormalities in connective tissues. Understanding the specific genetic mutations associated with Marfan syndrome is essential for accurate diagnosis and genetic counseling. Various types of FBN1 mutations have been identified, ranging from missense mutations to frameshift mutations. These mutations result in abnormal fibrillin-1 protein synthesis, defective microfibril structure, and overall tissue fragility. Marfan syndrome often leads to aortic root dilation, which poses serious cardiovascular risks like aortic dissection. Clinical assessment includes imaging and monitoring blood pressure, and management includes beta blockers. Surgery may be necessary and lifelong monitoring is important. Ectopia lentis, a hallmark of Marfan syndrome, refers to lens displacement caused by weakened zonules. Diagnosis requires ophthalmic examination, including ultrasound. Management options range from correction with eyeglasses or contacts to surgical intervention like lens refixation or extraction with lens implantation. Marfan syndrome affects the skeletal system, leading to long limbs, scoliosis, and pectus deformities. These abnormalities can be managed with regular monitoring and surgical interventions, improving patient outcomes and quality of life. Mitral valve prolapse, MVP, is when the mitral valve bulges into the left atrium during systole and is often seen in individuals with Marfan syndrome. MVP can vary in severity and may cause symptoms such as palpitations, chest pain, and shortness of breath. Diagnosis and assessment of MVP are done through echocardiography. Management options involve regular monitoring, medications, and surgical interventions if needed. Retinal detachment is a potentially sight-threatening complication observed in individuals with Marfan syndrome. The weakened connective tissues in the eye, including the zonules, predispose individuals with Marfan syndrome to retinal tears and subsequent detachment. Diagnosis of retinal detachment in Marfan syndrome involves a comprehensive ophthalmic examination, including indirect ophthalmoscopy, slit lamp examination, and optical coherence tomography, OCT. Prompt diagnosis and intervention are crucial to prevent permanent vision loss. Treatment options for retinal detachment may include pneumatic retinopexy, scleral buccal surgery, or vitrectomy, depending on the characteristics and extent of retinal detachment. Regular follow-up visits and serial examinations are necessary to monitor the reattachment status and detect any potential complications. In individuals with Marfan syndrome, joint hypermobility and arachnodactyly are common musculoskeletal symptoms. These can affect mobility and daily activities, requiring physical therapy, orthopedic supports, and modifications for normal functioning. Assessments involve examining joint mobility, range of motion, and deformities, with referrals to specialized therapists as needed. Genetic modifiers play a role in Marfan syndrome, influencing how the condition presents and its severity. Identifying these modifiers through genetic testing can help predict disease progression and guide treatment. More research is needed to fully understand their interactions and implications. In summary, managing pregnancy in women with Marfan syndrome requires comprehensive preconception counseling, close monitoring of cardiovascular health, and collaboration between specialists. The risks include aortic dissection and mitral valve regurgitation. Prophylactic surgical interventions may be considered to reduce risks. Administering anesthesia in Marfan syndrome requires precautions to minimize cardiovascular risks. Preoperative evaluation, appropriate anesthetic agents, and vigilant monitoring help prevent complications like aortic dissection. Collaborative care is crucial for optimal outcomes. Marfan syndrome is associated with a wide range of cardiovascular complications that significantly impact patient outcomes and overall prognosis. Aortic dissection, the most feared complication, occurs due to the weakening and disorganization of the aortic wall, primarily in the ascending aorta. Clinical assessment includes monitoring of blood pressure, regular echocardiography to assess aortic root dimensions and valve function, and advanced imaging modalities such as computed tomography, CT, or magnetic resonance angiography, MRA, for a more comprehensive evaluation. Management strategies for cardiovascular complications in Marfan syndrome depend on the severity and specific manifestations. regular surveillance, medical management with beta blockers or angiotensin receptor blockers, and prophylactic surgical interventions to prevent aortic dissection are crucial components of care. Advancements in management and treatment of Marfan syndrome include TGF-beta inhibitors, TAVI, endovascular stent grafting, gene editing, and targeted genetic modifiers. These emerging therapies offer hope for improved outcomes and quality of life for patients with Marfan syndrome. Marfan syndrome is a complex genetic disorder that affects multiple organs, including the eyes, heart, and bones. A team of specialists is needed to provide optimal care to patients. By advancing our knowledge through research and collaboration, we can make a positive impact on the lives of those with Marfan syndrome.